This session is Unveiling the Gallup Center on Black Voices, Detroit Data. Please welcome the director at Gallup Center on Black Voices, Camille Lloyd.
Good morning, everyone. It is good to be back on the island. Thank you all for joining me this morning. I want to, first of all, before I start off, to thank the Chamber and Sandy and his team for their partnership with the Gallup Center on Black Voices in bringing what we say it's a proof of concept to life, which is this hyper-local approach to how do we address and create an inclusive process around advancing equity in our society. And so we're appreciative of that partnership. We're appreciative of the Detroit Racial Equity Blueprint Group as stakeholders for your time, for the input in being intentional with us to say, how can we create a research design that doesn't just allow us to have national benchmark, but to also allow us the ability to zone in on the unique needs of Detroiters. So we are particularly grateful for the time and the effort and the intention, and through those relationships was able to reach over 50 different community organizations and residents in the development of this research. So truly an intentional process that was the better part of 2.5 years. And so we're grateful for that partnership at the center. I also want to thank my Gallup colleagues, some of whom are here, but also for all of the hard work that they continue to do since we've launched the work of the center and being able to amplify Black voices and to also quantify people's experiences. And I'd be amiss, most importantly, to thank you all as Detroiters for filling out those surveys. We sent over 150,000 mail packets to households across the city and the greater region. And you all saw it not robbery to give us your discretionary efforts, to share your experiences, and to complete those surveys, whether it was filling it out and mailing it back in, or going online and answering those questions. So we're appreciative of that. So I want to give you a little bit of context in terms of the data that we're going to be going through this morning. It's a very high-level view. You all will have access to the report and the actual data itself to go into the details. But get wonky with me a little bit, right? Because I'm really excited about these data. So the survey was completed in fall and winter of 2022. We had almost 12,000 respondents, and respondents in the city as well as in the Tri-County area of Wayne, Macomb, and Oakland counties. And the overall design was the city was the focus, but the region was the frame. And so when we're going through those data, I'll say Detroiters, that's what I'm talking about, everyone that we heard from across the region, and then I'll get city specific. So we wanted to figure out how people were doing. Gallup over the years have asked Best Life Possible, which is a life evaluation scale. We asked people on a scale from 0, which is your worst life possible, to a 10, which is the best life possible. And it's really an overall subjective measure of well-being. And so we asked people to rate their lives now in terms of how they're doing, and to also think about what that will be like 5 years from now. So their ability to live their best life possible. And what that has allowed us to do is to create a life evaluation index that we were able to do also for the Detroit Resident Voices survey. And when we do that, crunching numbers and analysis, we were able to create 3 categories, of this measure of overall subjective well-being. And what we know is that for thriving, to be thriving in your well-being, this is well-being that is strong, consistent, and progressing. And so we know some specific things about Detroiters who are falling in this bucket in terms of their overall well-being. So if you think about thriving, these are those who are rating a 7 on that. How's my life going now? Okay, I'll give it a 7 or higher in terms of my overall evaluation of how well things are going or my overall quality of life. And when we ask you about your life in the future, you give that an 8 or higher. So you're thinking, my life is going pretty well now, and I'm optimistic about what it will be like 5 years from now. So you'll fit in this bucket of thriving. So for Detroiters who are thriving, when we ask them about, kind of those experiences that they're having in their everyday life, what we see is that Detroiters who are thriving, they're largely satisfied with institutions in their community. So that's the community overall, the schools, the quality of health care, the affordability, the availability of affordable housing. And what we see is that they're also more likely to report experiencing lots of enjoyment and happiness in their everyday lives, and that they are also likely to have lower rates of health ailments, and they're pretty confident in their ability to get ahead by working hard. Then we have this other bucket where struggling, so those that are struggling in their well-being. And what we see is that, this is well-being that is moderate, but there's some inconsistency. So maybe you're not, kind of thriving in all the areas, but there's some room for improvement. For the most part, these Detroiters are satisfied in terms of the educational system and their ability, the availability of healthcare, and the availability of good jobs. But what we know is that they do not feel like they have what they need to achieve their financial and their career goals. And they're much more likely to be dissatisfied with the availability of affordable housing. So that's what we know about Detroiters that are falling in this bucket of struggling. So when we think about suffering, those who are suffering in their well-being, this is like well-being that is at high risk, right? And so in order to kind of fit in this bucket, you'd have to rate your current life evaluation of a 4 or less in terms of how things are going in your life now, and also a 4 or less when you think about 5 years from now. So if you were to categorize this, you would be like, these are folks who are like, my life isn't going well now, and I'm really not optimistic about how much better it will get in the future as far as my ability to live my best life possible. So what we know about Detroiters that are fitting in this bucket when we ask them about their everyday life experiences is that they are least likely to be satisfied with the availability of good, affordable housing. Few feel that they have what they need to achieve their career and financial goals, and they're more likely to have health ailments. So we ask a series of questions about whether or not you've been diagnosed by a physician or a nurse, and we have a list of conditions that we ask. And we see that these individuals who are falling within the suffering category are also more likely to have those health ailments, or to say that, yes, they've been diagnosed by a physician or a nurse. And what we see is that 2 out of 3 of them do not believe that they can get ahead with hard work. So this is what we start to think about, my ability to live my best life possible. Those that are falling within this bucket are least likely to think that they have a chance. So what are some of the numbers? Yes, in Gallup, I'm going to come with numbers. So what do we know about Detroiters? Well, overall, for Detroit area residents, 50% of Detroiters are falling within this thriving bucket that I described earlier. Another 45% is within that struggling category, and 5% is in that suffering in terms of their overall well-being. Well, how does this compare nationally? From a regional perspective, they're very similar in terms of what we see nationally for the overall US population, and then for the work that we're doing at the center among Black Americans, also very similar in terms of what we see for overall well-being distribution across the 3 groups for the region. So let's get in a little bit about how does where you live and what you look like impact in terms of the overall well-being and where we see in terms of group distribution. So we see that Black Detroiters are significantly less likely, those that are living in the city, to be falling in this thriving in their well-being category. We do also see that there's a significant distinction between whether you live in the city or whether you live in the suburb. And so 40% of city residents and 52% of suburban residents, way they rate their lives, are falling within that thriving bucket. So we do see some differences there. All right. One of the things and the beauty about the data and why almost 12,000 of you responded is the ability to drill down to see what does this look like across the different neighborhoods within the city in terms of how Detroiters are doing in their overall well-being. We see some pockets of excellence, and there's some areas for opportunity in terms of the distribution of well-being. By the way, the dots that you're seeing represents every single survey respondent that participated in the study, so that you can kind of see the range and the depth of the study and our ability to drill down at very, very nuanced levels to understand where those pockets of excellence and where do we need to target efforts in terms of helping Detroiters raise their overall well-being. The next thing I want to say is, so the next question is, okay, yes, now we know how Detroiters are doing. What are those things that we can do? Where do we start? None of this is kind of new. Some of it is validating and quantifying your experiences. But what do we know about the things that are driving or determining how Detroiters are rating their lives? And the important thing that we found out, it helps us to understand where do we start when we start to think about collective action and what we can do to help improve Detroiters' overall well-being and how they see their ability to live their best life possible. In order of importance, when Detroiters are rating their lives, the aspects of their experiences that are most important in determining whether or not they're thriving, struggling, or suffering are falling in one of those three categories: economic opportunity, jobs and work, and education. Particularly around economic opportunity is their overall perception that they have the ability to get ahead by working hard. When we think about jobs and work, it's their overall satisfaction with the availability of local jobs and their ability to receive job training and services related to being able to achieve those jobs that they want to have. And from an education perspective, it's access to high quality public schools and leveraging opportunities to achieve their career and financial goals. The second most important category to the things that are driving overall well-being and how they rate their everyday lives is the aspects around their health and well-being, particularly those access to quality health care, so their satisfaction with the level of access that they have to quality health care, or how easy it is for them to access quality health care, as well as the satisfaction with the availability of quality health care within their community. So from a health and well-being standpoint, if Detroiters are able to give a 5 to those questions around, I am satisfied with the overall availability of the access that I have to quality health care, or I find it easy or very easy to access quality health care. Some of that is having access to a doctor that look like me, so a doctor that shares your racial, ethnic, or background and experiences, that they're much more likely to be thriving in their overall well-being. The second category is this element of community and environment. What we see is that Detroiters who are saying, yes, they have access to social opportunities or community events, they're also more likely to say that they have strong social cohesion, whether that is having people that they can rely on in case of an emergency, but also feeling like they live in a community where people care about each other. So when you think about the order, so it's that personal, right? Do I have an ability to achieve the economic goals that I have for myself, whether that's through strong access to public school systems and education as far as job training, or feeling like I have a fighting chance, which is my perception of being able to get ahead by working hard. And then there's those physical aspects, right? So being able to access quality health care. We see that this community aspect is also very important to how Detroiters rate their overall life. And that is in relation to their satisfaction with the neighborhood conditions and neighborhood services. That this is also an important factor in how they're currently evaluating their lives. And the last bucket I want to talk about is this idea of justice. And this is satisfaction with law enforcement. As part of the national work that we do, we have 6 key research pillars where we ask questions around, these are the 6 key areas of life that when we understand people's experiences in terms of their ability to lead a life well lived, those were the 6 key research areas. Justice is a big area. This idea of relationship with law enforcement, the ability to feel safe in your physical environment. Not that this is not a key area for those living in the city, but in relation to how people were rating their current lives, this is an aspect that really only popped up for us from an analytical standpoint for those that were living in the suburb, and this idea with their overall satisfaction with law enforcement. I don't want to play down because this wasn't a significant driver of overall current life evaluation for city residents, because what we did hear from city residents, though, is that they would like to have more police presence in their neighborhood, and moving away because of high crime was the top reason city residents gave as well why they would want to move out of the city. So I do want to say, from a relational standpoint, this came up more of a driver for overall life evaluation among those living in the suburbs. One of the things that we are particularly interested in understanding is what are the differences in people's experiences across these key areas that we know are important to how they rate their lives. And so that's what you're looking at now at the screen is really some unique experiences that we were seeing across different groups on those areas that I mentioned were most important in terms of how Detroiters were rating their overall life in terms of their quality of life. A lot of these are all actually among city residents in terms of some distinctions that we see. When we think about economic jobs and work and the ability to access those opportunities to achieve your educational and your career goals, we know that work is a big part and an important part for Detroiters. So we ask people, what are those barriers that you are facing in terms of finding and keeping a job? So what we see, and this is among Detroiters who told us that they were currently employed, so we asked them what were the barriers to you finding and keeping a job. And what we saw and heard from residents is that 51% of them said having access to a car was the major barrier for them finding or keeping a job. The other big bucket was 44% of them saying access to convenient public transportation was a major barrier. So that is access to transportation that can take you to those opportunities or access to transportation that can move you around so you have more options available to you. I have on here also the level of training, and this was another big category that Detroiters cite as a barrier for them finding and keeping a job. And this 44% for the city was something that was particularly interesting, but why it's on the chart up here is that this was 42% for those that were living in the suburbs as well. And this was the only other measure that the two areas were close on. So city residents and suburban residents, both 40 and about 4 in 10 were saying that having access to the level of training that's required was a major barrier for them finding and keeping a job. The other thing I'll note in addition to the slide was, what were people's experiences? We asked the question about, what was the likelihood that you would leave your job within the next 12 months? And so among those who were saying that they would think about leaving or looking elsewhere, we asked a series of questions about, what was that reason? And it was important because what we did see and was able to uncover is this unique experience that stood out for Black employees who lived in the city, that they were 1.7 times more likely to say they want to go work somewhere where they have a more positive work experience. So that's a work experience without harassment and discrimination. That's something that we found that was unique among Black employees living in the city, because this was a meaningful difference that we saw when we compared Black employees with those of other race and ethnicities in terms of why they were thinking about leaving. The other thing I want to talk about is this idea about the importance of having access to a quality education system or being satisfied with the educational system and schools in the area. We know it's an important driver when we think about the education and how that impacts people's, the way people rate their quality of life today. So what we know about Detroiters and how we compare that to the national average in the work that we're doing is that residents in the city are about 2.2 times more likely to be dissatisfied with the educational system or school in their area. And what's a particular unique experience among those 18 to 39 is that over half of them say that they think that children would be better off going to school in another area. So when you start to think about how people are making decisions and the reasons why they would consider moving out of the city, second only to the physical safety, so wanting to move away because of high crime, this idea of wanting to move to a place that is a better place to raise your children was the second most cited reasons that people gave as to why they would want to move away. So when you start to think about over half of 18 to 39-year-olds are saying that they think children would be better off going to school elsewhere, and it being the second most cited reasons as to why people would want to move away from the city, I think that's an important dynamic as we start to think about what does collective action look like and what does solutioning looks like around addressing some of the needs of those that are living in the city. And the last thing I think it's probably not surprising to you either is that Black residents were also less likely to say they had access to those social and community aspects of life, which we know are important to building social cohesion and helping overall well-being. So what does this all mean? We also ask a question about, whether or not residents would recommend their area to others, or whether it's to a friend or associate, as a good place to live. What we have found in the data is that despite the challenges that Detroiters were facing, especially city residents, over half were more likely was saying that they would recommend the city as a good place to live. That's something that we see some differences across race and ethnicity, but when we also look at the region overall, we see that this is 80%. So 80% of residents within the region say that they would recommend the city as a good place to live. And I think that there's a lot of enthusiasm around living in the city. There's a lot of pride and passion. And I think when we start to think about in the power of and, what does collective action look like? So there's enthusiasm. Let's add opportunity when we think about addressing the needs for residents in terms of their ability to achieve a life well lived. Thank you all so much. Check out the data in the report.